Okay, let's dive in. We're tackling a really core topic today.
Yeah.
Filling root canals, endodontic obturation, technically speaking.
Uh,
And our mission, really, for you clinicians out there, is to figure out the best combo. Which materials, which techniques give you the best seal, the strongest bond.
Yeah, and we're focusing on the big face-off. The
Yep.
old school resin sealers like AH+ versus these newer bioceramics like Sure Seal Root or SSR.
And technique-wise, it's the quick single cone method against the more traditional, let's say, involved compaction technique.
Exactly. And what's really interesting, is how these new materials are changing the whole game, the whole philosophy.
How so?
Well, for ages, it was all about packing in as much gutta-percha core as possible. Maximize the core material.
Right. Fill the space.
But now, these bioceramics, they're letting the sealer do the real work. It's becoming much more sealer-centric. It leverages the material's own properties.
Okay, so let's talk about those properties.
Yeah.
Why are bioceramics SSR, for instance, so different? What's the magic compared to resins like AH+?
It really boils down to bioactivity. BC sealers are hydrophilic. They actually like moisture. They use the fluid in the dentin tubules to set.
Unlike resins, which tend to be hydrophobic.
Precisely. And they bond chemically to the dentin. They form hydroxyapatite as they set, basically integrating with the tooth structure.
And crucially, they expand slightly, right? Resins can shrink.
Yes, that slight expansion is key for a tight seal. Resins have that polymerization shrinkage issue, which can lead to gaps. BCs tend to seal tighter because of that expansion.
So how do we actually measure this? How do we prove that bond is better?
The main metric is push-out bond strength, PBS. It measures how well the material adheres, how much force it takes to dislodge it.
And the data.
Yeah.
What does it show for bioceramics like SSR versus AH+?
Well, the studies are pretty consistent here. PBS is significantly higher with SSR compared to AH+. That holds true across the board, coronal, middle, apical thirds.
Any specific technique pairing stand out?
Actually, yes. The group using cold lateral compaction with the SSR bioceramic sealer, they showed the highest PBS overall. And, importantly, BC sealers generally result in fewer voids, fewer gaps in the fill.
Okay, higher bond strength, fewer voids. That sounds great for bioceramics. But what about the technique? Single cone is so much faster.
It absolutely is. That's a huge practical advantage. We saw one study showing single cone with a BC sealer taking, under a minute, like 57 seconds?
Yeah, compared to cold lateral compaction at over 2.5 minutes, that's nearly 3 times faster. Think about chair time savings.
No question it's tempting. But speed isn't everything, especially when you hit complex root shapes. Like oval canals, those are notoriously hard to seal perfectly.
Right, just sticking a single cone in an oval space might leave significant gaps, especially near the top.
Exactly. And that's where compaction techniques like continuous wave condensation often perform better according to micro-CT studies. They tend to adapt the gutta-percha better and reduce voids, particularly in those coronal and middle thirds of oval canals.
So compaction gets a better fill quality in those tricky spots.
Generally, yes, in those upper sections. But here's a nuance, and it's important. One study actually found something interesting with single cone plus a good bioceramic sealer, iRoot SP in this case.
Oh, what did it find?
It showed superior sealing and fewer voids, specifically in the critical middle and apical thirds compared to warm vertical compaction, regardless of the sealer used with the warm technique.
So SC with BC might actually be better deeper down in the root.
In that particular study setup, yes. And clinically, there's a meta-analysis suggesting single cone with BC sealers has really high success rates over 18 months, around 92%. Statistically, it wasn't significantly different from controls, but clinically, that's a very strong performance.
Okay, let's try to pull this together. For the clinician listening, what's the practical takeaway? How do you choose?
All right, if your absolute top priority is maximum bond strength, that PBS value, and minimizing gaps in the coronal and maybe middle parts of the root, then cold lateral compaction combined with a bioceramic sealer like SSR looks like the gold standard based on this data.
But if speed and simplicity are major factors,
Then if you're going with the faster single cone technique, using a bioceramic sealer is definitely the way to go over a traditional resin sealer. The performance jump is significant.
and SC might even be preferred in certain situations.
Yes, definitely consider SC for those really narrow, long, or curvy canals where getting compaction instruments down is tough, or where you want to minimize the wedging forces.
Got it. Okay, Before we wrap, a really crucial tip for anyone adopting these single syringe BC sealers. It's not just plug and play, right?
Absolutely not. Moisture control is key, but in a different way. You need some moisture, so smear layer removal rinsing with EDTA is mandatory. The sealer needs access to dentinal fluid to set properly.
And how you place the cone matters too.
Critically, you need to insert that gutta percha cone slowly. Think 3 to 5 seconds. This creates hydraulic pressure, helps the sealer flow into irregularities, and importantly, helps prevent pushing excess material out the apex.
So it sounds like the big picture is that advances in material science, these bioceramics, are allowing a simpler technique, single cone, to perform really well, sometimes even challenging the more complex compaction methods. It's chemistry helping mechanics.
That's a great way to put it. The focus shifts.
Which leaves us with a final thought for you to ponder. We see that maybe the best outcome technically comes from pairing cold lateral compaction with bioceramics, but single cone is drastically faster.
So the question becomes, how will you, in your practice, balance that speed and efficiency, the cost factor, against these nuanced performance differences, especially considering the fill quality might vary between the top and the bottom of the root? That's the complex calculation these materials now force us to make.